Wherever the big news story is happening, we're geared up to break it. TVC News, first with breaking news.
Well, good morning and thank you very much for joining us. I am Yori Folani. We've got a couple of subjects to look into today. The first affects all of us, although, you know, that's a controversial way of putting it. But yeah, it does affect all of us. Perhaps there's a sense in which the ladies have a firmer grip on the handle of this particular topic. But then again, maybe I shouldn't put it like that. The men should have as firm a grip. We're talking about family planning in Nigeria, and indeed creating access to family planning in Nigeria. On the one hand, Dr. Salma Anas is our guest. She's a special advisor to the President on Health. She's reaching us from our Abuja studio. Good morning to you, Dr. Anas.
Good morning. Good to have you. And good to have me also today. Yeah.
Indeed, same thing here. I made a couple of controversial statements in there that perhaps the ladies should have a firmer grip on this subject, but then I just reconsidered and I said, wait a minute, everybody should have a firm grip on it. Tell me, Dr. Anas, you evidently must have been studying this whole matter. When we talk about creating access to family planning in Nigeria, assuming that everybody knows what family planning is what need is there to create an access to it? Have you heard or seen through, research that there isn't a sufficient access to family planning?
So thank you so much, Mr. Folarin, and thank you. Good morning, Nigerians. I'm happy that you corrected that. It's not the woman's issue, but it's the totality of everybody that is involved. So it's everybody's business, family planning, yes. So access to family planning, we are not where we want to be. So I will use statistics to really use evidence so that Nigerians understand that I'm not just speaking my mind, but speaking based on evidence and science. So we are still far from reaching where we want to be. So there's limited access to family planning commodities to Nigerians, both especially women of reproductive age group. And when we talk of women of reproductive age group, they are women between the ages of 15 to 49, as well as men also. So recently we just had the National Demographic Health Survey, and this is what we use to measure progress in terms of maternal, newborn, and child health, plus nutrition indices in Nigeria. So the most recent one, 2024, showed that only 15% of Nigerians have access to modern family planning commodities and services where they have expressed the need that they want to use it, which is just a very little progress that we have made from the 2018 NDHS survey, where we were at about just about 12%. So what does it mean to us? It means that only 15% of Nigerians are using modern family planning, commodities to plan their families. And when we talk about family planning, you are talking about both the size, the number of children that you want to have, as well as also the timing, the spacing of your children. Maybe you want to have 2 years, 3 years, or 4 years gaps between your children. So these are the two main crux of the matter around family planning. So that was why I say it's everybody's business. It's not just the woman's business. Because most families want to plan their families. They want to decide the number of children that they want to have, and they also want to decide the family size that they want to have, as well as the spacing of the children. And some people call it child spacing, because this is now looking at just the spacing of the children. Do you want to have 2 years interval, 3 years interval? Because all have its own positive implications on the health and also on our population and on everything, as well as our development. So that is what it means. And some people call it healthy timing and spacing of pregnancy. So those are terms that have been used, but at the end of the day, what it means is the same thing that we're talking about. The number of children that you want to have, that is your family size, and the spacing of the children.
What have you found is the impact of polygamy on effective family planning in Nigeria? Even if one is doing it right, classically, that is in terms of one woman, one man, one wife. But then there are so many legitimate one man, multiple wives. So even when you do apply family planning, how is that going to work? Because I think people, they have their traditional beliefs. So let's say a man, for instance, let's take the Islamic injunction about, look, it's not theoretically, you can have up to 4. That's 8 if they were to go at 2, per wife. And that would be 8. Between a man and a wife, if it was just a monogamous marriage, that's 2, but it's now been quadrupled. What effect does that cultural, traditional practice have on the efforts that you are engaging in?
So let me put it that way. There are cultural beliefs and there are religious ways of doing things. But when it comes to decision about family planning, both monogamous and polygamous families, they have a right to make decisions. They have the right to have informed information so that they decide not just about their family size, but also about the spacing. Because it has implications, first of all, on the health of the mother. The mother takes in conceive, and the mother bears the pregnancy for 9 months. And after 9 months, she goes through the process of delivering the babies and postpartum. And through every stage, it has implications on her health. So you can imagine a woman that is not having access to family planning between the ages of 15 to 59, and then no intervention, no action taken. It means this woman will be having babies almost every 2 years. That is, if she is exclusively breastfeeding and also feeding the baby, and if she is also benefiting from what we call the lactation amenorrhea, that is breastfeeding. But that is also not 100%. But let's say there is nothing. It means every year the mother can be having babies. So the body cannot take it. The physiology of the body is not made that way to contain it. The best that the mother can contain is to space these children between 2 years and above. And then by the time she comes back to eat again, she has replenished herself, she is nutritionally fit. That is the implication of the mother, the health of the mother by herself. And then during pregnancies, there are a lot of things that can happen. During delivery, there are lots of complications that can happen. That is why today, Nigeria records one of the highest maternal deaths globally. We are still talking about over 500 women dying per 100,000 per annum. So when you translate it, it means you are having about 80,000 women dying every year in Nigeria as a result of pregnancy causes, delivery causes, and postpartum. So you see, when you look at issue of polygamy and monogamy, it has the same implication on the health of the mother. And this is just on the mother. Then you now go to the children, looking at health aspect of it. The more children you have, the more the siblings will not have adequate care, adequate nutrition. So they end up having malnutrition. I have seen a mother with 5 kids. The eldest was just about 7 years. And then having 4. All of them were malnourished, including the mother. So you see, you are depleting the child of care, you are depleting the child of nutrition, and it also affects the family completely. So this is looking at it at the aspect of health, and then it overall affects the community. So outside health, because family planning, the positive impact of family planning is not only on health, it has economic values.
Indeed.
When you reduce the number of your family size, what we call the population management, it has impact on your economy, your growth of your economy. It reduces strain on the infrastructure that we have, including the health systems itself, because you have larger numbers beyond the capacities that are available. And then at the same time also, if you look at issues of climate change, and what is most important that bothers my mind as a Muslim woman also, is that it has implication on the insecurity, because it does not allow the family to manage the number of children that they have. It does not allow them to properly train their children rightly. And this it did not start today. This has dated back long time ago. So if we talk about family planning method, one of the traditional methods of family planning, the withdrawal system of family planning, where the man does not ejaculate because he wants to reduce the family size. This has been in the books, religious books. This was practiced also by the Prophet ﷺ himself in order to reduce family size. So when you are not ready for it, you don't have to have children. You have to be ready to have a children. First of all, you have to be ready even to have a family. You have to be ready to get married. You have to be ready that you are going to have children that you're going to bring up morally upright. You understand what I'm saying, Mr. Folarin? And
Indeed,
this is the message. So,
yes.
so you plan your family size, according to your capacity, according to your resources, according to your mental capability, because it's about upbringing, moral upbringing. A family has a responsibility, not just for health, but feeding your child with nutritious food, ensuring education of your child, moral upbringing of your child. It is a responsibility of every parent. If any parent cannot do that, then don't call yourself a father or a mother.
Indeed.
I think we should pass that message to everyone.
Excellent. Now, you've spoken about the responsibility of the parents, you know, or the married couple, both men and women to this. Indeed, traditional methods such as you just cited, the withdrawal method, of course, health professionals tell us that, well, yes, there is much that can be said for it. However, health professionals say it's not scientific. A lot of discipline, control looms very, very large, as opposed to a professionally, instituted, mechanism. So on the one hand, there's the traditional, whatever the merits or demerits of it are. Then you spoke about family planning products at the beginning of the program. So there are two aspects to this now, aren't there? And then we're talking about creating access. Now, does it go beyond going to the neighborhood chemist and asking for a pack of condoms, for instance? Is that the kind of access, or are there other particular access that men and women would take up?
So first of all, let me say about the product. The products must be available and within the reach of every Nigerian, both men and women. So I've just talked briefly, and you've talked about the traditional that I'm not going to elaborate on. So we are talking about the modern commodities, which includes the contraceptive pills itself. Some are oral, some are injectables, some are also intrauterine devices that you insert into the uterus of the women, to release the hormones. And then some are also implants that you put under the skin to release the hormones that will prevent pregnancies. There are other barrier methods like the condoms. And also the condoms are also in two categories. There are female condoms and there are male condoms. But also beyond that, there are permanent methods, because there are families that have decided no more having children. So they can have access, maybe due to reasons of health or their own personal reasons. So they can have surgical interventions like the tubal ligation. And those can also be done for men, where they can have vasectomy. So those are permanent ways of doing it. And there are also emergencies, where you don't plan and you accidentally, when unplanned, had sexual exposure. So there are also emergency contraceptives that can work. So having understood that, so those products, what we call the family planning commodities, are very, very important, because we must have access to them. And that accessibility is limited. And that has to do with a lot of issues, around financing. So this time around, the conference in Abuja that is taking place, National Family Planning, is talking about how do we sustain commitments and how do we increase funding for family planning commodities, within the National Health Sector Renewal investment that is being spearheaded by the Minister of Health, in line with President Bola Ahmed Tinubu's commitment to ensure that women's health are fully prioritized within the agenda of development and also the health agenda. So what we are saying is that the commodities must be available, they must be accessible. We have to deal with issues of social barriers and cultural barriers, just like some of which you have mentioned. Because some women, they are due to beliefs that they are not accessing those services. There are women that don't have that belief, but the services are not available and they cannot afford to buy. So issues of affordability are some of them. So at the moment, I'm glad to mention that His Excellency President Bola Ahmed Tinubu is committed to the women's health. And you cannot guarantee a woman's health without access to family planning commodity. Just like I said earlier, you allow her to continue to have babies every year. So in a lifespan of 30 years, she can have 30 babies or 15 babies. That is very dangerous to her health, apart from other implications on our development. So President Bola Ahmed Tinubu, he came and he continued with the strengths and existing commitments that we have made in the past to realize, to improve access to family planning commodities. Nigerian federal government started procurement of commodities since 2012. His Excellency President Bola Ahmed Tinubu continued and increased the funding. And we have attracted additional support from some of our donors, our international organizations. But that is still grossly inadequate. This is the federal government commitment, and we are happy we have sustained that commitment over the years, and we are doing much more. But what we are saying today is that we need to decentralize that commitment and have similar commitment at the subnational level, where every state of the federation should be able to have a budgetary allocation for family planning, because it's an essential commodity in maternal, newborn, and child health. And we are advocating for that. And I'm glad some state governments have already done that. They have a budget line, and they've aligned with the federal government basket funding in the procurement. But we need to do much more. Very few states have already indicated that commitment and are procuring. So once we do that, it means women will have access to free. Because most of Nigerians women are vulnerable and they are poor. They cannot even afford to buy paracetamol, talk more of these commodities. So once the state makes it available to them, they can have access. Because the survey that I was talking about also, the NDH has also indicated that there are huge gaps. It showed to us that women that are willing, that desire to use family planning commodities, and they cannot have access to it. They are almost more than 21% of our populations, of that women of reproductive age group.
I was just curious, Doctor, what does the research available to you say about the take-up of vasectomy in men, for instance? That would be playing a direct part of it. It's just one of numerous measures. It's sort of more permanent, isn't it? And I believe that there's also a female equivalent to the male vasectomy. Would you say that this is one of the more radical approaches? If there's a reason for it, maybe health, maybe we've satisfied our quota quite early in age and we don't want to take the risks. Are people going along, are people taking that particular route?
So, Mr. Folarin, I should have asked you that question because you are also a Nigerian man. Most Nigerian men are very skeptical, and I will say unafraid, or they are not sure of themselves. They can decide that they want to have reduce family size and also space children. But when it comes to subjecting themselves to access family planning, especially the vasectomy, it's very, very low, very insignificant in our population. So we are still doing a lot of awareness creation, but it all has to do, with the issues of the gender imbalance. And then
too many men are scaredy cats.
The conception, almost all, and then the belief that the family planning is a woman's issue. Woman should deal with it. So I always say it's a family issue. Everybody is involved in it.
Okay. Luke has called in. Good morning, Luke. Luke in Abia, I believe. Good morning. Luke, are you there?
Good morning.
Oh, it's Port Harcourt, right?
Yes.
Oh, good morning, Luke in Port Harcourt. Thank you for calling in. You got a question for Dr.
My brother, when we are talking sensitive matter like this, I will advise that we direct this that we're supposed to talk to. When you talk about family planning, you and I know about the circumstance that is taking place in this country. The issue is that our Northerners brothers are not giving ear to this. So we should direct this question to them direct. We should take this question direct to them. I have almost two friends that when I look at the number of their family size, we ask questions and say, it's like some people are creating more problems for some people. So my concern is that let this question be directed to who that is supposed to. Let us call these people and sit them down, talk to them, that look, the number of their size, family size is large. How can one person be having, you can't compare it with these people from the south.
I don't.
You can't compare them with these people that is from the south. Let us call these Muslim brothers and talk to them. That look, it's beneficial to both parts.
Okay, let's look at that. Let's look at it. Is it, Dr. Anas, do you find that this is a regional issue, that it's a matter of northwest, south, or east?
Well, it's not a regional issue only. It is a national issue, I can say that. The recent survey has shown up to local government level, about 172 local governments that have the highest burden of maternal death. But of course, 50% of the burden of maternal death happens in the northern part of Nigeria due to several reasons that we have mentioned. We can also separate when you look at the literacy level, also the low literacy level, and then the lack of awareness, lack of awareness, lack of understanding, lack of knowledge about the issue. I, as a Muslim woman growing up in the northern Nigeria, I have not seen any family that is interested in losing a wife or a family member. So I see and attribute that mostly to lack of knowledge and lack of information. So this is why, for me, as special advisor to the president under the office of His Excellency, we've decided to do things differently, because a lot of people see when you talk about family planning, it's a foreign agenda. But it is our agenda, and that was why I even quoted the Prophet of Islam that I mentioned earlier, that we need to understand, we need to speak the same language, we need to be on the same page, we need to generate what are the social determinants that drive the increase and non-acceptance uptake of family planning commodities in our communities. So those conversations have to happen, not by us, the technocrats, not by me and you, but by the real people that matters, the religious leaders, the community leaders, all the faith-based organizations. We have to generate the social determinants from that source and then find solutions to it. And this is why we say we need to drive it and have come up with homegrown solutions to tackle the issues. So it's not about talking, and this varies from region to region. What happens in the northern region, even in the northern region, what happens in the northeast is not the same with what is in the north central or in the northwest. And the same thing when you take the southern part. They have their own peculiarities also. There are issues also there when it comes to issues of maternal health. So we have to deal with it, in the perspective of the communities. What are their perspectives? What do they believe? And I've done that with different communities in Nigeria, and all of them believe that women are dying from pregnancy-related causes. Women are not having access to family planning, because when you speak with the men, they also want to reduce their family sizes. Then how do we do it? Nobody is happy about women dying. Nobody is happy about losing children under 5 years. So we need to really do things differently from what we have been doing in the past. Because if you look at the trend in maternal mortality and the trend in family planning uptake in Nigeria, we've not made very good progress. We are very slow, despite the federal government commitment. And we are saying in this administration of His Excellency President Bola Ahmed Tinubu, we must go down to the community, the grassroots level, and generate the solutions with the people themselves so that we can operationalize and implement. And part of doing that is part of also having that a local government autonomy at the local government, working with the local government chairman and the key stakeholders at that level.
So because of this urgency that you are stating, should we look forward to an expansion in communication upon this vital subject, a concerted campaign? Because that's one of the problems, not just with this very, very important topic that we're talking about, but also other initiatives by government. You people are very, very busy in there, but oftentimes, or maybe I should say sometimes, the people that would benefit from all of this work don't get to hear and understand it consistently enough. So should we be looking forward to something of an explosion in communication?
Yeah, communication is a great part of the campaign and the intervention we are embarking on. Communication, community engagement, advocacy, because a lot of people are ignorant. They don't understand the implication of all that on them. So there is need for advocacy, intensive advocacy, identifying the key influencers, the key gatekeepers, the stakeholders, so that we are all on the same page. And I think that
Okay.
will be the beginning for us to begin to see changes in what we are doing.
Okay, then. Well, I want to thank you very much, Dr. Salma Anna, Special Advisor to the President on Health, for coming to speak with us. The conference is continuing. The conference is still continuing, or it has ended? It is ongoing.
It's continuing, and I'm inviting all of you to join us, not only women, but all men should be there, all relevant stakeholders, religious leaders, young people. They should all be there. Policymakers should all be there. Our legislators are already there. Thank you very much.
Thank you very much, Dr. Salma Anas, for coming along and speaking with us about this important subject. Okay, stay with us, please. We'll take a break now, and when we come back, we'll look at, you know, it's been all in the news, the tax reform bills. Well, the president has ordered that maybe we should have a review on this whole matter. Let's talk about that when we come back from a break. Do stay with us.
Hello, TVC Communications. How can I help?
What makes TVC the right choice for my business?
Excellent question, sir. Let me share some exciting facts with you.
Start your day on TVC Entertainment with Wake Up Nigeria, a family and lifestyle show. Your view empowers women globally.
It's your view, let it count.
Entertainment Splash delivers the hottest celebrity trends. On TVC News, we keep you informed with breaking news and in-depth analysis of events shaping the world.
I will continue to speak the truth.
TVC News at 7 and TVC News at 10 p.m. delivers the most